Hello everyone and welcome to the NPTEL course on pharmacognosy and phytochemistry. I, Galvina Pereira, Assistant Professor, Institute of Chemical Technology, Mumbai, will dwell you deep through the integrities of pharmacognosy and phytochemistry. In this particular session, I'll introduce you to the concept of pharmacognosy and phytochemistry and we'll learn into scope of it. But let's understand the course first. This course is intended with an objective that whenever you study this course, you will be able to understand, appreciate and evaluate different drugs of natural origin. You will be able to understand them with respect to their sources, with respect to the compounds they contain which are called as phytochemicals, and how do you apply these drugs, where all these drugs find their application. So that's the main objective, and post learning this course you will be able to classify drugs of natural origin based on the compounds they contain. You will be able to understand the sources, properties of compounds, applications and different classes of phytochemicals belonging to all these plants, and in the end or towards the end of the course we will also study on the methods to evaluate, which is very essential to ensure the quality of the drug. So, evaluation methods, understanding of the plants and classification of drugs based on the phytoconstituents is what we basically focus this course on. To start with, what is pharmacognosy? Now, let's start with a little historic time. Pharmacognosy didn't start at a particular date. So, if you see us as Homo sapiens, as humans, we started exploring nature for our food, for our needs, and that's where we started consuming plants. Now definitely many of these plants made up for our food needs, but while consuming some of these plants proved fatal, that is they took lives of people, but some of these plants humans observed were able to change their physiology, change something in them or give some reaction. Some of these plants were hallucinogens, some of these plants causes you to go to sleep, we call it as sedatives, and some of these plants help to kill the pain, we call it as analgesics. So man in his search for food also come across or stumbled upon different plants with different therapeutic applications, and this was slowly monitored as the evolution happened, and this bank of plants which humans knew could have medicinal applications grew. So we study them in this field, we call it as pharmacognosy. So pharmacognosy basically is derived from Greek word which is your pharmakon, that is a drug, and to gain knowledge of, gignosko. So you gain knowledge of a drug. This was attributed in as early as 1815 by C.A. Snyder, who gave this word pharmacognosy to us. But like I said, the evolution or that drugs bank of plants or products with medicinal applications have been happening since time immortal, you can say. So Wallace explained pharmacognosy as a distinct department of pharmaceutical sciences which deals with either a study of structural, physical, chemical or sensory attributes or characters. Now this could be of crude drugs which are of animal origin, vegetable, mineral, nowadays even microbial origin, and this includes the whole process including their history, cultivation, collection as well as application. A recent definition of pharmacognosy is given by the American Society of Pharmacognosy, which defines pharmacognosy as a study of physical, chemical, biochemical or even biological properties of drugs or drug substances which are obtained from them. as well as, or like potential drugs. They might not have been right now categorized as drugs or drug substances of natural origin, which are being used to alleviate disease disorders, or which have been used to search for new drugs from natural sources. So, not sounding in verbatim, but what you need to know is pharmacognosy is basically all the studies that you need to do for understanding drugs of natural origin, including their physical, chemical, structural properties, attributes, origin, history, everything included. Now, when we go to phytochemistry, phytochemistry deals with the molecules present in the plants. So, if you specifically is phytochemistry, it means the chemicals that are present in plants. So, phytochemistry will focus more on isolation, what structures this compound have, from where they have been biosynthesized, what function or what role they play in plants, and this phytochemicals can be your primary metabolites that may help you in the build up or gaining normal physiological functions, or they might have some secondary defensive functions. We call them as your secondary metabolites. So, depending upon their role they play in plants, your phytochemistry will classify them into primary and secondary metabolites, and study of all these attributes is totally summed up in the branch what we call it as phytochemistry. So, this is something which will help us in development of newer molecules herein. So, what is the scope of this subject? Why are we learning this subject, or what is pharmacognosy and phytochemistry helping me out with? So, once I learn this subject, I'll understand different things. First thing what I learned is, when I take a drug, like a plant drug, animal drug, or a mineral based drug, I understand the sources of this drug and slowly how this drug contributed to drug discovery. Now, I'll just give you a WHO report which says that despite all the modern allopathic advancement, 80% of the global population still uses plant based medicine or some form of traditional medicine. A still bigger eye opener is whatever molecules or drugs we have it in market right now, of that approximately 60% are either natural or nature derived or nature inspired molecules, from which more potent molecules have been prepared. So, definitely your pharmacognosy and phytochemistry knowledge is going to help you understand the sources and is going to provide you leads for the drug discovery. The next thing this knowledge will help you is, whenever you have a herbal drug with you, or whenever in your prescription you have anything to do with drugs of natural origin, you will understand the process of quality control, standardization and authentication. Are they genuine? Are they not? Are they of good quality, or they are of a poor quality? Are they adulterated, substituted by any means? So, we will understand the quality parameters of this drug. Next is, numerous drugs so far we have seen have been used in traditional system of medicine, and traditional system of medicine has its own logic. Now, we don't apply that to pharmacognosy and phytochemistry, but the pharmacognosy and phytochemistry knowledge, the knowledge of molecules, the knowledge of plants, will make us understand different steps that have been involved in the traditional processing of this herbs, or how these herbs are being used in traditional medicine. Now, going to a little modern version of it, you will see numerous plants, animal based products or microbial based products have now come in market as nutraceuticals, natural excipients and cosmeceuticals. So, our knowledge of this subject is also going to help us understand nutraceuticals, natural excipients and cosmeceuticals better. Now, let us try to learn them one by one. So, take for example sources of drugs as leads. So, when you say historically, when people tried a traditional herbal medicine, you will say a willow bark which contains salicin. Now, salicin, which is there in willow bark, people used to consume it for its analgesic effect. Slowly, more and more research started into the analgesic effect of willow bark, and they came across a molecule called as salicin. This was isolated, this was purified, and this was converted into more potent and more, what you call it, as a pharmacokinetically and dynamically better moiety, and that was your aspirin. Now, this was a still a long journey, but after that journey you will see that still more better molecules were discovered, and as a result the requirement for aspirin fell down. Now, come again, aspirin was discovered as a molecule which helped in what is called as blood thinning. So if you see, now it is not used for fevers, it is not used for analgesic effect, it is more used for your blood, or more used as a blood thinning agent. So willow bark gradually gave you a modern drug. Same way Artemisia annua, which contains artemisinin, which is a anti-malarial molecule, but if you take it from a plant, had little bioavailability issues, that it was a little lipophilic. This could be made more polar by, if you carefully see, what is changed here is this particular ketone is made into hydroxy and a diacid has been added just to esterify it, and that artemisinin was converted into artesunate, which was much more hydrophilic and more bioavailable. Now, going to the next molecule, you will see that from rhubarb there was a molecule called as rhene, and rhene is known to irritate the gut. That is your like a purgative, we call them. Now, this purgative effect is what your anthraquinones were mostly known for. Again, this was chemically modified just by a simple acetylation, and this acetylation led to molecule which is called as diacerin. Now, diacerin had a completely different set of moieties. It is used in arthritis, and it is used to prevent degradation of cartilage that happens in joints. So people take diacerin as a anti-arthritic agent or something that prevents the cartilage damage. So definitely your nature is inspiring, and here you come across the fourth example, and that is your opium. Now you will see opium is a kind of a different molecule. In a way it can be a hallucinogen also, can be an analgesic also, and it has numerous activities. So yes, the effects of morphine were observed, but just see carefully what is done here. Now, what is done here is, if you take this hydroxy, convert it into ketone, and if you take this methyl and attach an allyl out here, you get what is called as antagonist. So, if you had morphine, and if you are having morphine poisoning because of morphine binding to an opioid receptor, this drug, which was very structurally similar, they kind of was prepared inspired from morphine to inhibit the effect of morphine. Now, same thing can be also abused. So, this was antagonizing it. Imagine something potentiating it. So, people, what they did is they took this hydroxys and kind of acetylated it. Now, diacetyl morphine is called as heroin. So, heroin is again a substance of abuse. So, you can use it, you can abuse it, it is a double-edged sword. But in your pharmaceutical industry, if we look at the positive side, these molecules have always helped us to develop better drugs for therapy. Now, going to the second case where you can use it. So, say for example, tomorrow I am preparing a preparation of Brahmi or from Adulsa, or how do I know that I have a genuine Brahmi with me, or a vendor has given me genuine sample? Because nowadays, even if you go to buy coriander in market, you will see that there are numerous other adulterants or other twigs which have been added deliberately or indeliberately, and same thing happens to your drug market. So quality control is very important. So in this particular course, we will study the methods, how people kind of authenticate their drug, what methods of quality control we say, that qualitative, quantitative methods. So we'll check authenticity, some botanical methods like microscopic methods will be studied, so that we can evaluate whether this arrangement of tissues is very fixed for a particular plant species. So if this same kind of arrangement is observed, there are some values called as leaf constants. So are these values really similar for the drug which is given and for the sample which is provided? In some cases, what people do is they exhaust the drug and give to you. So you might have come across clove which is almost devoid of oil. There is absolutely no oil, there is absolutely no flavor in that clove. So you can check the presence of chemical constituents by doing something called as phytochemical evaluation. So what classes of compounds are there? How are we going to evaluate those class? By using chemical tests. We will see that in this particular course, and you will be able to evaluate that as well. And then there are methods to quantify if clove oil is present, maybe a compound eugenol which is present in clove oil, how much is it actually present? So you will come to know, is the clove of good quality, is the clove processed well, or it has been stored or processed in a very substandard way and is no longer fit for medicinal use. So quality control, standardization, authentication is something we will be studying in our pharmacognosy and phytochemistry course. The next thing what this course will help us with is validation of traditional medicine systems. Now once we understand what plants are, what compounds they contain, the physical and chemical attributes of these plants and some therapeutic effects of these plants, we can just revisit our traditional medicines which use these plants. So maybe when you study alkaloids, you will study Vaccin. Vaccin is there in Vasaka. So if you extract your Vasaka, in which solvent the Vaccin will be high? Why do Asavas and Arestas? So imagine the compounds that are water insoluble. Traditional methods used ghee to extract them. If they were lipophilic, traditional methods use hydroalcoholic. So whenever they wanted a combination of alcohol and water to get those compounds out of plant, they used it as Asavas or Arestas. So Asavas, Arestas use hydroalcoholic, ghee preparations use lipophilic, as well as your kadhas when you boil it used as a very hydrophilic preparations to take out the actives from the plant. Same way, if you go to see another procedure in traditional medicine called as Sodhan Prakriya. Now Sodhan Prakriya is often referred to as detoxification or potentiation. So for detoxification, we need to understand what is poisonous in the plant. And if I say the poisonous compound in my plant is an alkaloid, take for example for aconite, it is aconitin. So if it is poisonous, how do I remove this poisons out? Then I study that if my compound is an alkaloid, I can use a little basic pH. That basic pH can be imparted by lime, chuna, can be imparted by little cow urine, or can be used by any alkaline substances and then extracting it in an oil or a lipophilic solvent. So we understand what this traditional methods did during the Sodhan Prakriya for detoxification as well as for potentiation. Potentiation approach was generally to improve the bioavailability of the drug. Then you can even try to understand bhasma preparation. See, when you try to consume iron or mercury or lead for that matter, they'll prove very fatal to us. But if you see some traditional medicines, they still use metal preparations, and these metal preparations were there in form of bhasmas. What exactly happened to those metals to render them non-toxic? What exactly these metals were processed and chemically what happened to them is something we can understand during the mineral processing. And then once you know what the actives are, once you know their mechanism of action, your dose and efficacy validation becomes much simpler for traditional system of medicine. Going to the next part, the modern ones you will see in market or you will see on the e-retail site. There are numerous herbal supplements, natural supplements. People claim numerous things as antioxidants, tonics, brain boosters. All these boosters are categorized as nutraceuticals. So nutraceuticals are nutrition plus pharmaceuticals, a combination of both, and that helps you give health benefits. They cannot claim to cure your disease, but definitely they do offer a good variety of health benefits. This includes your dietary fibers. You will see your oats, your brands, your isabgol. They've been categorized as your basically your polysaccharides as dietary fibers. Somewhere they help you decrease the glycemic index in your diabetic patients and cholesterol in a hypocholesteremic patient. Whereas if you're suffering from disease such as cancer, you will require more of antioxidants. So polyphenols or carotenoids. Polyphenols are little hydrophilic, whereas carotenoids are little lipophilic. So your diet or products which are rich nowadays in markets, you have supplements such as Lutivit for your eyes, you have zeaxanthin, or in polyphenols you have ellagic acid, gallic acid derivatives which are even helping you in cognitive health. So all these antioxidants, immune boosters, ashwagandha, ginseng, what do they contain? How are they helping us, and how should they be given to the patients or given to the market is what we see. Even when it comes to your microorganisms, your prebiotics, it's a huge market. Certain lactobacillus or bifidobacteria, which is a part of your gut microbiome, they've been sold out as products. And your Cognosy knowledge will definitely help in understanding what they are, how they are prepared, produced and used. Now, when you're learning pharmacognosy and phytochemistry, we'll be dealing a good set of drugs, and some of these drugs can be used as excipients. So, there is a need or a growing need of what is called as green or eco-certified ingredients. So more green, more eco-certified, more safe they are, more biocompatible they are. So this is what your subject is going to help with. So take for example colorants, beetroot, chlorophyll, annatto, cochineal, they are all there in market. How do you prepare this? How do you process them? How do you use them in your products so that they can be a very stable formulation? Coming to sweeteners, people nowadays resist use of high calorific diets, and they want to switch to something which is low calorific or non calorific. So sweeteners such as stevia, thaumatin, monk fruit or mongroside is nowadays used as a substituent or a zero calorie sweetener. Emulsifiers, natural emulsifiers like your acacia, tragacanth, lecithin, gelling agents, agar gelatin, even your flavor market. People don't want synthetic flavors, they want natural flavors because they are more safer. There are no process impurities in them. So mint, vanilla, your knowledge of pharmacognosy and phytochemistry will help you understand application of all of these drugs as excipients also. Now cosmeceuticals, we just not restrict ourselves to drugs, we also venture into the cosmetic domain. So you will see nowadays the market flooded with cosmetics which are of natural origin. Your algal, marine is also coming in terms of ingredients. Your brightening agents, kojic acid which is obtained from fungus, lemon extracts, or even your hair oils are loaded with ingredients such as amla, hibiscus, brahmi. So all of this are obtained from nature. We just need to use them, process them and understand their phytochemistry so that they can be wisely applied. So emollients, take for example your creams which you apply. You don't want the moisture, you don't want a dry skin, so you want to retain the moisture. Emollients help you with that. So you will see your beeswax, jojoba or jojoba oil, almond oil, all of this create a very lipid barrier and prevent what is called as epithelial loss of water. On the other hand, there are certain plants which will help you ingrain water in your skin, such as aloe vera. If you see the aloe vera mucilage, it is laden with water. Applied to your skin will get hydrated quickly. Your cucumber. In a similar manner, even if you see your perfumery market, People are again wanting to go very green label with more natural fragrant molecules. So your rose, citrus, musk, spices, all this which are obtained naturally have been used here. So all in all, if you go to see pharmacognosy, there's a huge scope, there's a huge market. If you see the drug market, the CAGR is 5, but if you see a Nutra and cosmeceutical market, the CAGR goes to as high as 7. So there's a good scope, there's absolutely good pricing, value for money. So definitely pharmacognosy and phytochemistry knowledge is going to help you venture out and understand these markets better. So here's a few reference books I want you all to read thoroughly throughout this course so that you enjoy it. And thank you everyone for your patient listening.